cardiovascular system. The cardiovascular system is a transport system of the body. The system supplies nutrients to and remove waste product from various tissues of body. It compresses blood, heart, and blood vessel. Organ system, we have three. The first, heart, pumps the blood to ensure it keeps flowing through the blood vessel. 2. Blood vessel, hold the blood and direct it around the body. 3. Blood, fluid which carries all the substances such as oxygen, nutrients, cell and waste product. The heart is a muscular organ with 4 chambers. The right atrium and right ventricle handle the oxygenated blood, while the left atrium and left ventricle handle the oxygenated blood. It has 4 valves, which is tricuspid valve, pulmonary valve, mitral valve, and aortic valve, to ensure one-way blood flow. The heart wall has 3 layers, which is endocardium, myocardium, and epicardium. Endocardium for the inner layer, myocardium for the middle layer, and epicardium for the outer. It's enclosed by the pericardium, a protective sac. The heart receives oxygen through coronary arteries and beats through an electrical system including the SA node, AV node, bundle of His, and Purkinje fiber. Next, we go to types of blood vessel. We have 3 types of blood vessel, which is capillary, vein, and arteries. So we go to the arteries first. Arteries are blood vessels that carry blood away from the heart. Most arteries carry oxygen-rich blood except the pulmonary artery, which carry the oxygenated blood to the lungs. Arteries have thick, strong, and elastic walls because the blood inside them is under high pressure. They help carry blood quickly to all parts of the body. For the example, the aorta is the largest artery. It carries oxygen-rich blood from the heart to the body. For the veins are blood vessels that carry blood back to the heart. Most veins carry deoxygenated blood, except the pulmonary veins, which carry oxygenated blood from the lungs to the heart. Veins have thin walls and valves to keep the blood flowing in one direction and prevent it from flowing backward. Blood in veins move under low pressure, so muscle help push the blood toward the heart when you move. For the example, the vena cava is the largest vein. It brings the oxygenated blood from the body to the heart. Next, we go to the capillaries. Capillaries are the smallest and thinnest blood vessels in the body. They connect arteries to veins. Their walls are only 1 cell thick, which makes it easy for oxygen, carbon dioxide, nutrient, and waste to move between the blood and body cell. Capillaries are found in all body tissue and are where most exchange of materials happen. For the example, in the lungs, capillaries allow oxygen to move from the air into the blood and carbon dioxide to move out. The cardiovascular system's main function is to maintain blood flow to all parts of the body to allow it to survive. The body takes essential nutrients like oxygen from the blood, and at the same time, the body dumps waste product like carbon dioxide back into the blood so it can remove. The cardiovascular system also plays a role in the immune response and the regulation of body temperature. Cardiovascular system also function for transportation, regulation, protection, and gas exchange support. For the transportation, carries oxygen from the lungs to the body and carbon dioxide back to the lungs, delivers nutrients, hormones, and waste products to and from cell. For the regulation, helps maintain body temperature, pH balance, and fluid level in tissue. For the protection, transport white blood cell and antibody to fight infection, contains platelets and clotting factor to prevent blood loss from injury. Gas exchange support move deoxygenated blood to the lungs for oxygenation. Delivers oxygen-rich blood to tissue for cellular respiration. Blood returns from the body to the heart via the superior and inferior vena cava. It first enters into the right atrium, then through the tricuspid valve and into the right ventricle. The right ventricle pumps the oxygenated blood through the pulmonary artery to the lungs. The oxygenated blood returns back to the heart through the pulmonary vein and into the left atrium. It goes through the mitral valve and finally into the left ventricle, which is responsible for pumping the oxygenated blood through the aorta and out to the body. Coronary artery disease, we call CAD, is a condition in which the coronary arteries become narrow or blocked due to the build-up of blood, reducing blood flow to the heart. Common symptoms include shortness of breath and chest pain, often experienced as chest tightness, pressure, or discomfort, collectively known as angina. To help reduce coronary artery blockage, it is important to eat a healthy, balanced diet, be more physically active, quit smoking, and take any prescribed medication as directed by a healthcare provider. These lifestyle changes and treatments can improve heart health and lower the risk of serious complications. A heart attack or myocardial infarction occurs when the blood flow to a part of the heart is blocked, usually by a blood clot or build-out of blood in the coronary arteries. This prevents oxygen-rich blood from reaching the heart muscle, causing damage or even death to that part of the heart is not treated quickly. Common symptom of a heart attack: chest pain or discomfort, pain in the arm, neck, jaw, back or stomach, shortness of breath, cold sweat. How to protect your heart? First, you must do active exercise at least 150 minutes per week. 150 minutes per week. Follow an overall well-balanced diet. See your primary care physician for a yearly physical. Stay hydrated by drinking at least 64 oz of water daily. Sleep 6 to 8 hours a night. By adopting a heart-healthy lifestyle, we can significantly reduce this risk. This includes eating a diet rich in fruits, vegetables, whole grains, and healthy fats, engaging in regular physical activity, avoiding tobacco products, limiting alcohol consumption, and managing stress life-threatening.